Hello viewer, welcome to today's episode of Health Talk Show. Today we are going to discuss about wounds, and our SMS line is 21144. Our Facebook and YouTube channel are GBS TV Africa. Today I have beautiful guests in the house who are going to take us through this discussion. Last week we discussed about fractures, and some fractures could also lead to wounds. Today we are going to understand more about wounds. I am your host, Lucy Wansa-Kariuki, and today I want to introduce my guests to the show. Welcome to the show, our guests, and kindly introduce yourselves. We start with the lady first.
Thank you. My name is Judy Mageka. I'm a nurse from Ngong, Kajiado County.
Welcome.
Okay, thank you.
Good. Thank you so much, Lucy, for welcoming me here. My name is Dennis Ntabiga from Tibabu Health Consultancy, a physiotherapist and also a specialist in neuro and orthopedic practice.
Wow, thank you so much and welcome to the show.
Thank you so much.
Yes, today it's about wounds.
Yeah.
And many people have had wounds from children to adulthood. Kindly, Daktari, introduce to us to this topic.
Basically, what I could say, at one time or another, everybody has had a wound, whether minor, a big or a major one. But today we are majorly here to discuss what is a wound and how to care for that wound, or how should it be treated. Do you need medication? Like, does home care help?
Yes.
Do you need healthcare system assistance? All that. That's what you are likely to talk about today.
Okay,
Yeah.
thank you so much. Judy,
Yes.
kindly let us understand what is this we are calling a wound?
In short, a wound is just damage to the skin,
Yes.
an injury to the skin. It can be broken, it can be closed.
Yes.
That's the simplest I can say. Any damage or injury to the skin that can expose the inner tissue, or just an injury that cannot expose the tissues,
Yes.
the inner tissues.
Okay.
Yes.
So which means there is some discontinuity in the skin surface.
Yes, exactly.
Daktari, what are some of the types or classifications of wounds?
Well, when classifying a wound, majorly we concentrate on the depth that the wound goes. We have the skin, we have said it's the covering of your body, right? That's what you're calling the skin, and actually it's the largest organ that you have in your body.
Before you talk about wound,
Yes.
you can kindly take us through the skin.
Yeah.
Yes.
Basically, to talk about the skin, it's the outer covering of your body.
Yes.
And we have said it's the largest organ in this case in your body. So this, as you look at it, it has several layers. We can have multiple layers, starting with the topmost, which we call the epidermis, which is the one you can see on top.
Yes.
It's very tiny, like a few millimeters deep. Then we have the lower one, which is mostly, it's white in color. If you are able to go through the top skin, the top layer, that is, it is called the dermis, right? That's now the second layer. Then we have the third layer, which is the mostly consistent with the fatty tissue. It's called the subcutaneous layer of your skin. And now the subcutaneous layer mostly differs in size with different people depending on how well you eat.
Yes, yes.
Yeah.
So what you are trying to tell our viewer is that skin is not just what we see.
No.
Because most of the time we think the skin is what you have as dark color or brown color. That is what we call skin. But at least you have been able to help us understand. Sorry.
Yeah, that is it. Like the color of the skin normally is from just a few cells that are on top of the layer of the skin.
Yes, yes.
But there are deeper layers that we normally don't see. And they also play a very important role in terms of your body covering and all that.
Okay, you had started to explain to us that wound can be classified in different forms. And you are trying to explain about the depth of the wound can be used as a method of classifying the type of a wound. Kindly take us through that as Judy to take us through another kind of classification.
When we do death in terms of classification, we are talking of like the first degree wound, which normally is just the top layer of the skin that is affected, that
Yes.
is the epidermis. You only get this maybe when you have a first degree burn, like let's say that's the kind of a wound that you will get, or when the topmost layer is affected. Only the lower layer, which is the dermis, is not touched. So you will normally get the top layer of the skin peeling off. That way it creates a loophole for bacterial infection, for any kind of infection to go through the body tissues which are beneath. That is now the second layer of the skin.
So we can be able to say that classification, we have deep wounds and shallow wounds.
Yeah,
and
now
we call
that's-
it that in the simplest way possible.
Well, yeah, I don't want to go into more of like the degree of measurement, because
Yes.
we have first degree, second, and third.
Okay,
That's
okay,
now
okay.
like
Depending on the layer that has been touched.
yeah, the layer that has been touched.
Okay, thank you so much for
Yes.
that. Judy, kindly take us through another kind of a classification. Yes.
Okay, besides what Dr. Ria said, there is another classification of wound, around 6. The first one I would say it's all about, you can find a wound that is open or closed. An open wound is whereby when you've been cut
Yes.
by something sharp. Let me give it an example of a knife. And the inner tissues have been exposed, the same way what Dr. Ria said. Yeah? And a closed wound is one that maybe something blunt has hit you,
Yes.
and it has destroyed the inner tissues.
Yes.
But you cannot be able to see from there. Maybe the only thing that can be able to, you can be able to show that there's a wound, it's a swelling
Yes.
and some pain.
And discoloration.
Yes, coloration.
Yes.
Then there's another one that is acute or chronic. Acute wound is a wound that a wound that usually heals very fast and very clean, good. We usually say it's a good wound because it's you get the for instance, I'm giving an example, a
Yes.
cut that heals very fast and takes a very short time. A chronic wound is one that takes a very long time, most of the times, and most of it it's usually very septic. Septic
Yes.
means it has an infection. Let me say germs
Yes.
in layman's language. Then another classification of wound is you can get a clean or contaminated wound.
Dirty.
A clean wound is one that does not have, it's as it is, as the word says, clean. No dirt in it, no debris, no nothing, no foreign body. But a contaminated wound is a wound that maybe has some, I would say, maybe someone has been involved in an accident, maybe possibly a motorbike in a rough road, has incurred a wound that is dirty because of the debris, or one that has been infected.
Yes.
You understand? Yes. It has been contaminated.
Yes.
Yes. Then another category of wound is internal or external wound. An internal wound is one that takes place that is inside your body.
Yes.
One that you cannot be able to see using your
see.
eyes.
Yes.
You understand? I would give an example, perfect example of maybe cancer of a liver. Cancer is a wound, I would say so, but it happens in a liver or any other organ of the body that you cannot be able to see until you go and get
Yes.
tested, or you get some imaging, a CT scan, X-ray or something of the sort that will show that there's a wound inside. And the external wound is one that you can be able to see that there's a cut, there's a wound here. Then another one is a penetrating wound.
Yes.
Penetrating wound is one that I would give an example of a knife, someone who has stabbed you with a knife,
Or an
or
arrow.
a gunshot, arrow. It has gone through the skin deep inside.
Yes.
And the last one is non-penetrating. It's just like a blunt. You've been hit very hard by a very blunt object that has not penetrated through
Yes.
the tissues.
Thank you so much, Judy. At least now we understand there are so many ways that we can use to classify wounds. Daktari, many times people do not know what may cause wounds. What are some of the various causes of wounds?
As she has mentioned already a few.
Yes, a
one
few, yeah.
is a direct injury, like maybe getting stabbed, as she has said. You can also get a wound through infection. Like for example, if you have any internal infection, then it opens up to form a wound or an internal wound or an open wound, as she mentioned. Then another issue that you might have that can cause, it's also the common one is like burns, also chemical burns. You can get a wound from that. And what else could you have? Like stings. They can form what you call cellulitis, which can lead to wound formation. Yeah, so there are so many reasons why you can have a wound. And those are just a few of them.
Maybe if I could add,
Yes.
surgical, you've gone for an operation.
Yes, yes, yes.
Maybe, for instance, maybe a cesarean section. Definitely it's a wound. They'll cut your skin,
Yes.
and that one will form a wound. So yes, just to add on what Dr. Ria
Yes,
said.
yes. Thank you so much, Judy, for that addition. Can we say that, of course, human beings are all predisposed to wounds?
Very true.
Because that is the body that we carry. But are there some specific predisposing factors, if I may ask, Dr.
Yeah, one could be occupation. Your occupation
Occupation.
could put you in line to have wounds. Like for example, you as a TV host, you are really predisposed to such. But imagine of
How?
somebody
How?
working in maybe a construction site.
Yes, yes.
They handle sharp objects. They handle maybe dangerous materials like chemicals and all that. They may get burns. They may get injuries in that process. Yeah, so they like one occupation can put you
Can
in line.
predispose.
Can predispose you to that. Yeah.
Are there others, Judy?
Yeah, to add what Dr. Ria said, which is very, very true, malnutrition. Any person who's not feeding well,
Yes.
who's not taking a balanced diet, can really get wound. Especially, I will give an example of a person who has kwashiorkor. You know, the skin is usually
Very fragile.
Very fragile. It dematters. It usually swells. Yeah? Then it makes it become so shiny and very predisposed, thinning of the skin,
Of the
which
skin.
predisposes the patient to have a wound. Then there is circulation problems. When a particular part of the body is not getting enough circulation, blood circulation,
Yes.
that one can predispose because that part of the body is not getting the nutrients that it needs
Yes.
to feed the cell for it to grow or to be maintained the way it is.
Yes.
So that one can cause the wound because because there's no oxygen or nutrients. Then another thing is infection. Infection, I would say infection like diabetes. That's a disease. It's an
Yes.
infection, I would say also, that can cause it usually can also cause, if you have a diabetic wound, as a complication of diabetes, it causes a wound that is usually very stubborn to heal. Yeah, then is the aging. When we age, definitely the elasticity of our skin reduces.
yes.
You understand? So that one also can cause a wound. Anything that goes through you can cut you, and it can bring something so big that was not. And healing process usually takes a very long time because of the same. Then issues like arthritis. Arthritis, infection of the bones. If the bone is infected and you don't treat it so well, it can penetrate. You understand? So many other things. Medications. The medications that when you take, they bring ulcers. You understand?
Yeah, yeah.
Yeah. So
Internal wounds.
Internal wounds. Yes, it all depends. There are quite a
And also
number
the
of
cancers,
causes.
as you said.
Cancers. Yes.
Allergies as well.
Allergies.
Yeah, allergy.
Exactly.
You eat fish.
Yeah.
From those.
Yeah.
You get
Those
blisters
blisters,
and
yeah.
that, right?
Those
From
are
the
when they open up,
scratching. You know. Yes.
Wow, thank you so much for that. I know most of the time, we've said from your introduction, Judy, wounds, there's break in the skin. What are other signs that this is a wound?
Oh.
Yes.
Let me take that as
It's okay.
it helps me. There's usually breaking of the wound, and one of the signs is pain. Definitely when one has a wound, there's usually some pain. At times you can get a scratch and do not realize that you have a scratch until
Yes.
you feel the pain. And there's swelling. Swelling of the wound also.
Yes.
You
Yes.
can also find some swelling of the wound. It swells. There is the reddening of that part of the wound. It becomes red. Yes, that one can also be a sign
Yes.
of the same. What else again?
Bleeding. They
Bleeding,
almost all
yes.
when you're stabbed, the first thing you see is blood. So
Yes,
when you have blood,
exactly.
then there must be a wound inside, right?
Yes.
Definitely.
When you have something like pus oozing from your skin,
Yeah.
Yes.
it means there's a wound inside.
Yes,
Then you have to look for that
exactly.
wound and clean it, right?
Yes.
Yeah.
What about for blunt wounds? Because I think what we've talked about are open wounds. What about the closed wounds? You have a closed wound, how will you know that it is a wound?
She mentioned
Because
pain.
the public knows that for a wound, the skin is open, it is bleeding, all those. What about for a blunt wound?
Okay, like for example, when you have a blunt wound,
Yes.
you will have something we call an hematoma. An hematoma is like the dead blood that accumulates beneath the skin. It will normally be very painful because it will swell. In that case, that's when you need that to be cut open for it maybe to be removed sometimes. But if it's harmless, then it may be left to just heal on its own. That's one way. When you another kind of an open wound is when you are saying you have pus inside. And one thing with pus, it means there's infection. When this infection is in place, then it keeps on like generating more pus.
Yes,
So the
yes.
pressure that is being created on the tissues will give you pain, and the pain is the major indicator of a problem within your body.
Yes.
Yes.
Now, are there some body parts that cannot be able to get wounds? And which are these parts? Judy?
Dead. We would usually say dead parts, like the hair, the
Yes.
nails, nails, hair, nails. What else again?
Nail beds will get wounds. Maybe
The beds.
Yeah, nail beds. If you get like some kind of maybe
The door. If the door squeezes your nails.
yes,
inside.
something of the sort, and then maybe if you get like pricked on your nails, you may get an infection inside, and then it may sometimes even get the nail to come off.
But
That's
the
actually
nail
not-
The nail
itself,
itself
no
that
wound.
has grown, that is not, that does not have the.
The reason why it's okay, my point of view is that the
Yes.
reason why it's coming off, it's because it has been infected and it has died from the point of origin, which is the nail bed.
The attachment.
Yes.
I get you.
Okay. Thank you so much for that. Now, if I may ask, many times we've seen people with these wounds. They're walking in the society and they don't know if they have wounds. Because as Judy was trying to explain, there are some tiny wounds that we cannot be able to visualize with our eyes. For example, nowadays we are using sanitizers. That is the only time you realize you have wounds on the skin. Or you're using something that is sour, like lemon, and you put it in the mouth. What about those wounds? How do they come about? Because with your eyes, you cannot be able to see. But the moment you use something corrosive to the skin, that is when you realize.
Yeah, majorly what happens, I think, is the fact that maybe you have undertaken a job that was quite rough on your hands, then it scratches off the top covering of the skin. You have said the skin is, the main function is mostly protective for the inner part of the body. So if you scratch off this top protective layer, which is mostly insensitive to many cases in terms of if it's not injured, then you will not get much of the feelings in like pain and all that. So if you do something that was kind of rough to your hands, then when you do so, now apply some kind of things like now the spirit, methylated spirit on top, then you will get that pain. That's when you realize there's some injuries to my skin, and those are the kind of what we call bruises, the kind of wounds that we call bruises. They are minor. They are not harmless, but you will normally feel them maybe at one point when you do something. Then another one that I could say is, for example, when you like you have oral thrush,
Yes.
right? That's infection of the mouth. That's when you will maybe eat something, then you feel pain. Or maybe at one point when you bite your tongue, you'll also have, you will have difficulty
Hot
eating
tea.
salty things. Huh?
Hot tea.
Yeah, because so those are the kind of wounds that we walk around with. They are minor. They have really not so harmless to us. And they're not so harmful to us, but they heal with the time. Yeah.
Okay, sometimes people have wounds and they don't go to the hospital. What is wrong with them? What is wrong with those people, Judy?
I would
Is
say,
it that they don't understand? Because you here, I am sure you are talking to somebody, maybe has had a wound for some time, and that person is still there.
I would say most of us in the community,
Yes.
we usually assume that a wound will usually take care of. Okay, most of the wounds, yes, if your immunity is good, can take care of itself, as long as that you've maintained the hygiene, as long as you are doing what is best, as in most especially hygiene and diet. You are taking a balanced diet that is rich in protein and vitamins, and maybe just like a scratch. Let me say a scratch. They usually go by themselves, as in they usually heal by themselves.
Yes.
But there are some kind of wounds that need medical attention, especially deep wounds, and that have been contaminated. Because the contaminants can have pathogens that cause tetanus, which one should be prevented by, which usually prevented by giving tetanus toxoid, what we
Yes.
call tetanus injection.
Okay.
So most of the wounds, yes, heal, especially the minor wounds. They can be able to heal by themselves, especially if the person has good immunity and takes that. But there's some which needs to be seen by the doctor.
Yes.
Yes.
Viewer, we are discussing about wounds. And right away, we are going to take you through some of the things you're supposed to do immediately you realize that you have a wound. As they described when we were starting, some wounds are acute, which means they can happen just like now, here, and wherever you are. What are some of the do's and don'ts during that particular time? Karibu sana, Dr. Dennis. Take
Asante
us
sana.
through the first aid.
All right. By speaking of first aid, I believe we'll be talking about acute wounds
Yes.
in this case, which means that it's a fresh wound, an injury that has just occurred.
Yes.
Like, for example, you have cut yourself using a knife while in the kitchen. What should you do? The first thing in any kind of a wound is to prevent excessive blood loss.
Excessive blood loss,
Yes,
which is bleeding.
bleeding in
Yes.
short. The only way to do this is applying pressure on the cut, the area that has been cut. You can do this manually most of the time, like take maybe a piece of cloth or anything like a towel, something of the sort, just apply on top of the cut and press gently and firmly enough so that to prevent excessive bleeding in that case, to prevent other complications that may occur due to bleeding. Because the reason why we say this, that you should apply pressure, some people have what we call bleeding disorders.
Yes.
Like their blood doesn't clot very fast. If you leave it to clot by itself without applying pressure, then they might go into a shock. Yeah, because of
They might
excessive
collapse.
blood loss. Yeah. So it's good that you apply gentle pressure but firm enough to prevent that blood from flowing out, because you have cut through what you call veins and arteries that carry blood through your system. So it's good that you prevent that blood from continuously flowing out.
Yes.
That way you will be safe. And again, another thing that you do is after maybe realizing that you have already managed to apply that pressure, you can also, if you are able to, tie around something so that you ensure that that pressure is constant. Yes.
For example, like a wood or a carton.
Yeah, a cut.
Yes.
Yeah, no, what you apply on top for you to rub around, because we are not assuming that everybody has a first aid kit in the house. So we are saying maybe just what you call be creative. Just find a piece of cloth or something, just rub around. It will be good.
That is direct pressure.
Direct pressure.
You compress the blood veins like there and
Yes.
there.
Yes.
Judy, we've seen in the news all over, during domestic violence, some women have been cut off their hands. And now the hand is there. You know, the hand has to continue moving and running because it has blood vessels. And I wonder what really happens. What is your advice for such people?
It's usually very unfortunate that we still have domestic violence, especially in a case whereby a limb is lost
Yes.
because of the same. But my advice is this: if you find yourself in such a situation whereby part of your limb is out,
Yes.
we usually say that it does not die immediately. Take that part of the body.
For
If you can-
example, if it's a hand.
if it is that hand, take it, wrap it so well in a polythene paper and put it in an ice pack. Ice pack. You get some ice, put the hand inside, then rush to the hospital with it. And for the wound itself, make sure that just the same way Dr. has said, apply a lot of pressure. Apply a lot of pressure as you rush to the hospital, and it's usually good for you to inform the hospital that such a case is going, so that the surgical team is ready to be able to see if they can be able to restore back that wound, because it is very possible for the wound for that limb to be restored. But that one means it's surely how fast we
Sorry.
are, yeah, in conserving the part of the body, and how fast we go to the hospital.
Okay, Judy, when we are talking about the part of the body, it can be the ear,
Yes.
the breast, the fingers. And now you've just told us that look for ice packs. I want to look at that woman in the village whereby even water is not available. How are they supposed to transport this part of the body? Because I know there is one thing that there is one area or one thing they're not supposed to do. Kindly, how can they transport? Daktari?
The challenge still we have is big within our country, specifically
yes.
because of the healthcare system. Maybe like in our up countries, you can get an hospital like 30 kilometers away.
Or even 100?
Or even 100 kilometers away. And most of the time they don't have these facilities we call refrigerators for them to get ice packs ready. So unfortunately such limbs may not be salvaged.
They may be lost.
They may be lost for good. And that's the part where we say it's unfortunate. So what we look at is more preservation of what is remaining. That part has already been chopped off. So what you do, preserve the rest of the harm that is already with you here. That's why we are saying, make sure you don't die by bleeding. Just apply that pressure until you get to the hospital. That's the best first aid you can give yourself.
But I think one thing we should not forget is when we are transporting these limbs, because I used to hear my grandmother say that in case you have a lost limb or any part of the body, do not carry it on a paper bag that is plastic. Maybe you use the current, you see after the NEMA eradicated,
The woven.
now, at least now we have better bags. I think those bags can be used.
Okay.
Just wrap in a cloth, because we may not have those, but we still have people who get domestic violence, and or even not necessarily domestic violence, even during the place of work. It is cut, accidents, in a RTA, road traffic accident. Sometimes you see the legs are there, the arms are here, the owners are crying for them, and not crash injuries. They can still be carried, so that at least we understand all hope is not gone.
Yes, very true.
Because now I know high sparks is the ideal way.
Well, okay, the reason maybe why you do not want to use a polythene bag without an ice bag is that it increases the heat temperature within where the lymph is being stored.
Is being stored.
That enhances the chances of that lymph dying very fast. So, but with an ice pack, then it's the best way to go.
Yes.
Yeah, but if you have a way of like a cooler box which you can store it in, it's much better to use a polythene bag rather than just, because also, you know, there's what you call frost bites, which can also kill the lymph, like ice, the ice is burning in nature. So you want to protect that lymph at all costs within the right temperatures. So there are cases which you should use the polythene and others you won't be able to use it because of one and two. So as we have said, still there's a challenge in like retaining that lymph viable.
Yes.
For it to be maybe, and even if you manage to get to the hospital, still how soon can you get that surgeon that fix that lymph? And how many successful surgeries have we had for lymph restoration? It's actually one, if there is the one that was done in Kenya. Yeah. So far in Kenya or in Africa, it's we have the chances of you getting that lymph restored is quite minute.
Oh my goodness.
So make sure you don't lose one.
Oh, how I wish our healthcare system could put such measures in place.
We are, it's work in progress, and we are all working towards that. We have, I think we have what you call the human labor. We have it. We have the workforce, only that maybe the facilities don't really enable us to do that.
Yes.
Yeah.
And also the health financing.
Yeah, the financing.
Because to get, we call them the plastic surgeons.
Yeah.
I don't know how many we have in this country.
I can assure you, we have a few. A good number. But the point is,
we have a few. But imagine the 47 million Kenyans all over the country.
A few could be around 50. If you post
a few could be around 50.
Yeah, if you could post one in every county, then it could be good.
At least
but
one.
Now they don't have the facilities to work in other counties. Like maybe go to Wajir, the most extreme part of this country. You will not find such, maybe a theater there. The major theater you can find is maybe a maternity one for delivery.
Yes.
Wow. The challenges of our healthcare system, but I'm sure all hope is not gone. Judy, kindly let us understand what are some of the things we can do now, not first aid, but to manage wounds in general. Now, when we talk of wounds in general, these are the classification that you are saying. Yes. Before you answer that, Daktari, I want to imagine sometimes we've seen people with bullets, people who have been stabbed with the arrows, especially in our up countries. Do we call them the up countries or the pastoralists?
Yeah.
As they try to shoot the intruders of their animals, they shoot at somebody. What are we supposed to do? Now, what is the first aid there?
Well,
we pull out the
procedure remains. However, there is a difference in terms of stabbing wounds. One of the advice that you give to a person, if you have been stabbed and the knife is still intact, don't remove it.
Come with it.
Just make sure it stays intact. Cover the top of the knife so that the bleeding is well controlled. If the wound is not through, like maybe a bullet wound, make sure that what you do, the knife remains intact, because you don't know how much damage it has done inside, and the pulling pulling it out might cause more harm than good, because maybe you have a major artery severed, and if you pull it out and then you have internal bleeding, then the chances of your survival get very much minimal. So like those penetrational injuries like arrows and all those, you want to maintain that arrow in place until you get to the hospital.
In short, what you're trying to say, don't remove.
Don't remove.
Come with it the way it is.
Yes.
If it's a bullet, just come the way it is.
Of course, if it's a bullet, it's already launched inside, you might not be able to remove it personally.
See it even.
Yeah, unless it's going in and out. So for an in and out, that's maybe a clean wound normally for a bullet. So you cover both ends, then you will have chances of survival. But in that case, for penetration like arrows and stab wounds like knives, don't dare remove that.
Thank you so much for that. Kindly, Judy, back to you.
Yes, different kind of wounds need
managed.
Are managed differently.
Yes.
For instance, the way you can be able to manage an acute wound or a clean wound is not the same way we can be able to manage a contaminated wound. So most of the wounds, especially the ones that are scratches, can be able to be managed at home. Just the same way Dr. said, just clean, apply pressure if it's bleeding, so that can be able to stop the bleeding. Then clean after the bleeding has stopped. Just clean the outwards, or if maybe you had a scratch or some debris entered the wound. Just put running water on it, so that can be able to remove the debris. And whatever the running water cannot do, clean running water, just remove manually. But make sure that your hands are clean. Remove manually, then afterwards clean the surrounding of that wound very nicely. If it's like a small, if it's a small wound, it is a minor one. Clean the surrounding, because if you don't clean the surrounding, whatever the pathogens that are in the surrounding area of the skin can be able to go to the wound that is fresh and cause infection. So make sure you clean the surrounding, and just use the normal. You can use any petroleum jelly nicely, then just leave it as that. But if you know that it's in the hand and you have to use the hand, definitely you cannot use an open wound cleaning. Get an elastoplast or something that you can be able to cover it so nicely while you are doing the activity you want to do. But usually prefer wounds to be open, so that there's aeration, of the wound, and which makes it dry faster, and also the healing process also is more faster.
Daktari, in our hospitals, briefly tell us, how are these wounds managed? Because she said that some can be left open, but we know some cannot. So how do you manage there?
Well, as she mentioned, management of a wound really is determined by several factors. One, if the wound is infected and it's proliferative, that means like it's producing that pus. Then you don't need to, you may not need to like cover it that much, because and then what you do, you put an absorbent kind of covering that absorbs that productive fluid that is coming from the wound. Then it should be changed as often as possible by the doctors. That's why you have to go in, maybe depending on how the wound is looking, you have to go in regularly for that dressing. Then secondly, if the wound is like the other management will be, if for example you have the cuts and all that, and then you come to the facility, you will have to be given a TT injection to make sure that you don't get a tetanus infection, right? For example, like now when you say you have been cut maybe by a knife, or you've been struck by an arrow, an iron sheet, because you don't know where those things were stored at the end of the day. So to avoid such complications like tetanus infection, you get a tetanus injection for that.
But the big wounds, they are done in theater?
Wounds that need reconstruction, maybe majorly most wounds will heal by primary healing. Primary healing is the one that you leave the wound to heal by itself, because the body has the ability to heal itself, as long as the conditions are maintained well. That is nutrition, then the wound is clean, and it's well covered to make sure that the infection doesn't get in. So it will heal by itself, but unless it heals by what you call second degree or secondary healing, which is now scarring, the scar that might hinder function to some extent, that's when you need to go for surgical correction or something of the sort.
Okay.
Yeah.
Okay, thank you.
Or even sometimes also the wound is very deep, and you need stitching.
Yes.
To help the skin close, because it might take quite a while before.
When do we apply skin graft?
Now, skin graft is when the wound is not healing properly. Like now, this is a chronic wound.
Yes.
Like what you call diabetic wounds. They sometimes are very stubborn. They don't heal that fast, and whatever much you try cleaning, dressing properly as regularly as much as possible,
Nothing
giving
works.
antibiotics, so that it might not be bearing good fruits in that case. That's the time now they decide, but you find the wound is going deeper and deeper, and sometimes now you're losing too much tissue. That's when you get a skin graft apply on top.
Yes.
to at least try to generate that skin that is required.
So it's not every wound that can be grafted.
No, no, no.
Can I request to be grafted
I don't think
as
so.
a patient?
I don't think so. Most of the
Yes.
time it has to be medically, like a discussion that goes around the medical, and then a decision is medically
Has to
made.
be made by the surgical team.
Yes.
Okay.
For you have to get a requirement, because a skin graft is not something fun. Huh? It's obtained from somewhere in your body to be put somewhere else on your body. So I don't need like where you need to put a wound here to cover
to
the
heal
other.
another one.
Yeah.
Oh my
So
goodness.
unless it's very necessary.
Yes. Thank you so much, Daktari, for that. Judy, we need to understand the kind of nutrition we need. Briefly take us through the nutrition management when it comes to wounds. Yes.
Basically, one has to take a balanced diet for our normal body to function the way they are.
Even
ought to
when
be
there are no
functioning.
wounds.
Yes, and we usually encourage that we should always maintain that balanced diet, such that in case of any wound, the body can be able to heal faster.
Yes.
But when you have a wound, regardless of which kind of we take a balanced diet the way we usually do, but make sure that you increase your protein content, and because protein usually develops, it builds the tissues.
Yes.
You understand? That is the work of protein.
The
in there.
broken tissues.
Yes, the broken tissues in the
Yes.
body. And it also heals the worn-off tissues. That's why it's usually very important. Then another thing that we should also take note of is we have to also take food that is rich in vitamins, because vitamins usually do what? They usually build our immunity. Without the immunity, if there's any,
Protective foods.
yes, protective foods like vitamins. Without the immunity, there's no way they won't. Okay, a pathogen might enter. You understand? And you don't have to. You don't have to use any medication.
When you talk
because
of these proteins, when you talk of these vitamins, what are you talking about?
Proteins are like
Examples.
examples. They are categorized into two. There's plant and there's animal protein.
good.
Animal protein is like meats, regardless of whatever meat, whether fish, chicken, goat meat, cow meat.
But not feasting.
Nyama choma.
Not feasting. Because sometimes when you say meat,
Yes.
you will find somebody.
Someone, yes.
You know you are talking to viewers.
Yes.
Judy. You will find somebody taking meat daily of a kilo alone just to build the tissues so that when wounds occur, they will be safe.
One thing for sure, viewers that I'd wish to advise,
Yes.
don't take something too much. Too much of something is usually very
Good.
dangerous.
Yes.
Take it in bits.
Yes.
Small quantities, just enough. That is what
A
the body
quarter
needs.
is for 4 people.
Yes. A
Thank
quarter
you.
is for 4 people. Just a few
I
pieces.
thought it
and
was
you
a kilo.
No. A quarter.
No, a quarter, yes. Meat is also dangerous, by the way. You take too much, it has a negative effect in your body.
So there is meat.
There is meat that is for plant, for animals. And animals also milk,
Yeah.
eggs.
Eggs.
Yes, very
So
nice.
we should not
any
go selling
product,
eggs
yes.
to buy rice.
No.
Yes.
Any product that comes from the animals, you understand?
Good.
That one animal product. Then there is the plant. If you cannot be able to take the animals because of one reason or the other, you're a vegetarian,
You are allergic.
you're allergic to animal protein, there is beans, peas. You know,
Cereals, generally.
cereals,
Cereals,
generally.
the nuts.
The nuts, very nice, very healthy.
Yes.
You understand? There's so many healthy stuff outside there.
Vitamins?
For vitamins, they are also divided. There's vegetables, like green vegetables, that are not overcooked. That one let me just emphasize, not
Yes.
overcooked.
Just
Because
to
when
steam
you
skuma
steam,
wiki,
yes, because
spinach.
when you overcook, what happens? You
kill.
kill the vitamins and the fruits that are all over. And you don't have to go for expensive fruits, just the ones that are locally available at that season. Like right now, there are oranges that are locally available, watermelons are there. You understand? And so many others that are locally available
The
that can
Nairobi
be avoided.
people are also near Thika, and we know we have the Del Monte,
Yes.
whereby we can get pineapples. Thank you
Yes.
so much, Judy. Daktari,
Yes.
kindly, are there some complications of wounds?
Yeah.
In 1 minute, kindly take us through.
As we said, one of the complications is excessive bleeding, which could lead to high shock.
Yes. And
due
even
to
death.
Shock, death due to blood loss. Then another one is infection, serious infection. One of the most serious is septicemia, which is like blood infection.
Because breaking skin allows, it's like a gate.
Yeah, when the wound is so
Doorway.
persistent that the infection becomes more of uncontrolled, and then you get that blood infection. Now it's more of you might be more of beyond saving. Yeah, yeah. And then another issue is that what you call what should I call it? When you have like a long-term wound, then it is financially draining. It's
Sure.
also it's financially draining for you to manage a wound all through. Like for example, a diabetic wound. That is one of the disadvantages of having a wound that is really taking your money.
Thank you so much.
To add on what Dr. has said,
Yes, yes.
there are issues like gangrene. You understand, that can cause your limb
The green is dry.
drying.
The
becomes,
layman's
yes,
language.
Yes.
It becomes
dries,
black, dries.
yes, and
You lose your limb.
yes,
Amputation. Yes.
amputation. Yes.
Okay. Next time you'll be taking us through prosthesis.
Yes.
Because I know it is now the next after you've lost your limbs, you've lost your legs.
Yes.
Yes. Thank you so much. And now that we've come to the end of the show, kindly give us your parting shot in 30 seconds. Judy.
Judy,
Yes.
let me my parting shot is this. Always ensure that you take a balanced diet, always, with or without the wound, such that whenever you have a wound in, or whenever you experience you have a wound in you, the healing process becomes very fast. Do what you can be able to do at home. Whatever you cannot be able to do at home, kindly come to the hospital so that you can be able to be helped. Don't assume, and listen to your body. Listen to your body. Thank you.
Thank you so much, Judy.
Well, I will leave with 2 points.
Yes.
One, your health is your obligation, and you have to really take it seriously. So when you have a wound, make sure it gets the best attention that you can get. And number 2, wound care is more of a collective responsibility.
Yes.
You and your doctor have to work together to make sure that that wound heals the best way possible, right? Because even if the doctor does the best in dressing you, gives you the medication, but you go back again, do the same injuries,
Yes,
it
yes.
becomes like now a repetitive thing. So I come from a background of where people don't get that much luxury of healthcare systems, so you don't want to get an injury at that level.
Thank you so much, my guests. It was a pleasure having you in the show. We've learned a lot. Viewer, this is GBS TV Africa. We were discussing about wounds, and what we are trying to tell you is that take care of yourself. And by doing so, you are going to stand in the day of adversary. That is when the wound comes. I was your host, Lucy Wansa Kariuki. Bye-bye.